So let's get started. We're going to start with COVID-19, if you don't mind, especially the vaccinations. Are drug companies testing their vaccines on children? And do you see families asking you, should I get the vaccine for my child?
Absolutely. Well, to answer the first part of your question, Pfizer has been conducting studies now on children ages 12 and above. Many parents are, they are asking many questions because they want to know if we advise it and if it's safe for their children. They're very interested and they want to protect their kids the best way that they can.
And I'm going to be completely honest with you. I have teenagers, as you know, and everyone in
Right.
my family has received the vaccine. I haven't vaccinated the girls. We're talking 16 and 18. So you say
Right.
go for it.
Absolutely go for it. I think, any ages 16 and above are really like the target age group because they're the ones that are interacting more with each other, whether it's socially or at school. It's just very hard to, seclude them because they do have to go to school and they're going to classes and things are changing. In-person classes will resume. And so their risk factors are so much higher than, let's say, for example, now the elderly population who is mostly vaccinated. So I recommend that you vaccinate your girls just for their safety and your peace of mind, just to know that they're going to be safe. And even if they do get COVID in the future at school, you know that they'll be safe. They won't be hospitalized. Their symptoms would be mild, if not non-existent. And I think there's nothing better than that peace of mind.
Thank you, Dr. Constant. Speaking of school, we have a video question from Kat. So let's take a listen.
My son is still in virtual school. He's been in school all year. And sometimes it feels like we are the only parents that still have our child in virtual school. So what I was interested in knowing more about was, what is the reality of sending your child back if you haven't done it yet? We're sending our son to camp. I'm a little nervous about it, to be honest with you. So we wanted to know the reality, what we should expect, what sort of how and if COVID is really spreading among younger children, and just kind of an overall understanding of what's happening as it relates to COVID and sending children back.
Thank you, Kat. Your thoughts?
Families like Kat are not alone. I think most families feel that they're the only ones who didn't send their children to school, but that's not true. There are so many other families that have been home since last year, and I know that's very difficult, and I commend them for being able to keep them at home and teach them at home, and that's amazing. But I will say this. They shouldn't worry about going back to school in the fall. What we've seen this year has been remarkable. The safety precautions that have been in place have been excellent. And what's been great is that children have not spread COVID within the schools. The high school level has been a little different. There have been outbreaks here and there. But as far as the lower level schools, middle school and below, the students have definitely been socially distant, and they have not spread COVID within the school, which is great. And so I would say to Kat and her family not to be worried. As long as your child continues to wear a mask and the school has the proper precautions in place, your child would be more than safe to re-enter school. And honestly, children are so adaptable. Even though her child was out of school for a whole year, he or she is going to totally adapt and jump right back in as if time hasn't been missed at all.
Oh, I can see all the happy faces and teachers and everyone saying, welcome back. It's going to be amazing to see. We have
Yes.
many questions. I do want to remind our viewers that if you do have a question, please send them in. It's so easy to do. Check it out right here. Question for the experts. All you have to do is email us questions@allhealthtv.com or just give us a call, 855-796-4475. Don't forget our website, allhealthtv.com. Doctor, we just talked about Kat's concern about her son going back to camp and school. I have another video question from Sarah that's a little bit similar as well. Let's take a look.
Hi, Dr. Constant. My name is Sarah. I am a first-time mom with a 16-month-old starting daycare in June. And since she's not quite 2 yet, she won't be wearing a mask. So I'm curious if there are other safety protocols you think we should keep in mind for her age group. And do you suggest we practice wearing a mask before age 2?
Thank you, Sarah, very much. Dr. Constant?
Great question. with going back to daycare, it's a good question because the daycares have been really great about keeping the actual facility nice and clean, limiting the amount of students per class, and really exercising precaution, even though the kids are not required to wear a mask below the age of 2. I think that the best advice I could give Sarah is to make sure that the school or daycare that she does choose will continue to put these restrictions in place, meaning less children in the classroom. Hopefully the daycare is not going to have 20 to 25 students in a room with one teacher. So if we could keep the rooms excuse me, with a low population, and the teachers are continuing to wear masks and washing their hands in between caring for the children, then she should be safe. Another good question to ask, honestly, and it's a fair question to ask, is if her particular teacher will be vaccinated. Because if her teacher will be vaccinated and have the same, what we call cohort of students, then the safety measures go up dramatically. It would be wonderful, and she would not have to worry about her daughter not wearing a mask. I say if you want to practice wearing a mask, that's great for the little ones, but it is very difficult, and it's totally understandable if they don't. But more importantly, if the teacher's vaccinated and wearing a mask and continues to wash his or her hands before interacting with the other children or changing diapers, etc., then I think that her daughter will be just fine in daycare.
That's a great point, and I'm really glad you brought it up, Dr. Constant. Okay, we're going to shift now to traveling. So a lot of parents who have been vaccinated, like me and you, hopefully want to start traveling or doing something over, the summer, the holidays, months to come. What suggestions do you have to keep them safe?
Yes. So that's great because, this is a very unique situation in that we feel much more safe because we've been vaccinated, and we can obviously participate in more activities that we haven't participated in over the past year. However, the caveat is for a parent like me that has young children, my children are not vaccinated and will not be vaccinated for a very long time. So I have to take into account that I need to protect them and keep them safe. So with travels, of course, we want to continue wearing masks. We want to travel to places that are not that don't have high positivity rates, for example, and participate in activities during our travels where we won't be in high population areas. For example, my kids and I are not going on trips where we're going to dine indoors or be in a very high populated area, go to museums and things like that. However, another family that has older children, and let's say the entire family is vaccinated, you have the liberty to participate in a few more high risk activities that maybe I wouldn't. So I would say that parents need to take into account what the situation is in your particular family, who's vaccinated, who isn't, and where are you going? Are you going on a camping trip or out to, a very remote area, or are you going to a high density population area where you'll have constant interaction with large volumes of people? Those are things to consider on your trip. But overall, traveling is back on the table, and I think that families should really enjoy their time off this summer and enjoy their family.